also, Ruth Maryland got involved in intervention work, really at the request of the survivors that we serve. One of the things we've been saying for years is that engaging with partners who are abusive is in and of itself a victim service.
We have crisis lines for suicide prevention, general crisis, intimate partner violence victimization, of course. But we lack services to engage people who use abusive behavior. The Gateway to Change hotline is a 24-hour anonymous and confidential hotline that is dedicated to receive calls from people at risk of causing harm to an intimate partner. We are fortunate to have received funding from the Bloomberg American Health Initiative to carry out this work. It's really an innovative approach because our primary approach to intimate partner violence prevention has been harm reduction for survivors, which is crucial. There's a need to engage some of the root causes of violence, which is the behaviors of abusive partners. Through the Gateway to Change hotline, they're able to have a more free-flowing conversation in a way that makes them feel heard, allows them to talk about other factors within their life that might be contributing to their use of violence.
We know that the legal system isn't seen as a resource for all of the families we serve, and we wanted to create a path for people to engage in our services that was low barrier. And now this hotline is a way for people to reach out without engaging a police officer, maybe doing it in the privacy of their own home. When people access this new hotline, they're going to engage in services and get support for stressors in their lives like unemployment, mental health support, substance misuse. We talk about change looking like honesty and accountability and a willingness to work on themselves.
I actually had a call from an individual recently who was calling the Gateway to Change line. And it was their first time actually ever talking about anything they had done to harm another person. They told me it made them feel safe to have this place where they could speak without being judged.
We've been getting phone calls from all different types of people. We've had people who are seeking help because they are worried about the way they're treating their families. We've had survivors reach out to ask what change looks like and what services are available for their abusive partner. We've had community partners reaching out to figure out how they can make appropriate referrals for people because they care about somebody who's causing harm in their family.
We're hoping that community agencies implement the Gateway to Change hotline. We're learning that people want to voluntarily engage in supportive services to take necessary steps to change.
I think this is really giving us the reach that we're looking for in the sense we've always said everyone has a role to play in ending intimate partner violence.